to wear or not wear. As we open the country, many people are asking if they have to wear a mask to stay well, even if it irritates their skin or makes them feel lightheaded or dizzy. Medical reporter Liz Bonus looks at the medical reasons to be considered when covering up.
From protesters in crowds around the country to those walking around in grocery stores and other businesses. When it comes to wearing masks, the CDC does suggest we all wear at least a cloth covering when interacting with other people. But from live events where you ask questions online to our Sinclair online Corona Alert Desk.
We know there's been some misinformation about masks, and some people are publishing misinformation to try to discourage people from wearing masks.
Dr. Jon Mendelsohn is a facial plastic surgeon and an ear, nose, and throat specialist. His team required to wear them while in close contact with the public. So I keep getting these reports of people very concerned that wearing the mask will be damaging to their skin and then perhaps they can't breathe and it causes other health problems. Where's that coming from?
I think there are a couple of things. I think number one, I think physically, if you watch people, our masks are being moved on and off, so there's some friction, which is creating some issues with with our skin. The second issue is, depending on the material that the mask is made out of, there are some sensitivities, as we all know and have. The third thing, I think the biggest thing, is probably people who are unfamiliar are breathing through those masks, and we are changing some of the characteristics of the skin.
Those changing characteristics are often referred to as maskne rather than acne.
The sebum, the oil production, therefore we're changing the pH, and we are seeing people break out. Commonly we're seeing these little tiny white bumps along those areas.
As for treatment?
We're managing acne as we would otherwise.
As for the breathing concern, Wendy Flynn is their licensed managing esthetician.
She's wearing a mask for her procedures, and she has difficulty breathing, and so do asthmatics. And it's actually could be unsafe for some of those people. They have difficulty breathing with the change in their environment. So it is a real thing, and it's a real thing to consider in terms of people with underlying medical histories.
Dr. Mendelsohn says everything is benefit versus risk, not the other way around. In some cases, prolonged contact has to be balanced with your need for a real breath of fresh air. I'm medical reporter Liz Bonus reporting.